Well, welcome back this morning. That was a good interview earlier about activities, but we continually bring you great news from our local pharmacists, Scotland Neck and Rocky Mount Bound, just the best. They're telling you about things that you need to be concerned or available. I guess what we have been talking about, you're still getting, or have you had some other response about getting that? I have told a few people
on the remote patient monitoring. Yeah, we've got a good.
Well, I've said something
response
about it. But Thomas this morning is going to be sharing about low blood sugar, which we take for granted. But so take it from there, and I'll sit and listen.
All right. Yeah. So we've touched on it at the last segment. We were talking about our remote patient monitoring program, and specifically,
this is part of it too, isn't it?
Yeah, this is very relevant for that. You know, we can monitor remotely your blood pressure or blood sugar, provide you with a free blood pressure or blood sugar monitor depending on what your needs are. We get those readings remotely, can intervene, call you if there's a high or a low, and it's covered by Medicare and Medicaid. So if you're interested in that, come see us at the pharmacy, Medical Park Pharmacy. But I really want
let me take it. These are offers that most people don't exist. Now, we know there are thousands of people listening. And he'll give you his location. Are you doing this in Scotland Neck also?
Yeah.
Mm-hmm. Okay. Well, when you mention it, both locations, but don't sit back and not know what's going on, because that's why men die so soon.
Yeah, being proactive is key, and you know, thinking about the future of your health is really important. It's hard to do with busy lifestyle, working and family, but you know, hypertension, high blood pressure, and type 2 diabetes are really prevalent, especially in the southeastern United States. And so we're hoping our program can really help folks. You know, it's designed for folks that already have these disease states, but you know, type 2 diabetes, you know, as we've touched on, can be reverse, you know, depending on how far down the road you are. But you know, one of the things we're intervening on for the remote patient monitoring folks that are diabetic is low blood sugar. So we're going to talk about low blood sugar. And so if you do have diabetes, I hope you're listening into this. I'm going to try to share some helpful information. And because usually, you know, when we're thinking about diabetes, we're talking about elevated blood sugar.
Yeah, that's right.
And that's how you're diagnosed, is you have, you know, there's multiple tests, but A1C is usually kind of a 3-month look back of what your blood sugar was averaging, and that's what that number represents. And
the magic number there is,
so if you're diagnosed with diabetes, it's 6.5.
6.5.
Above 6.5 or above is considered diabetic. 5.7 to 6.5 is pre-diabetic, and so you really want it, you know, your A1C to be less than 5.7. And something that I would recommend, especially if you're, you know, if you feel like you're not eating well or you're not exercising, maybe like you did in the past, ask your doctor to pull an A1C, because if you're relatively healthy, they might not be looking at that. They usually will pull.
That's exactly right. That's exactly right.
And so they sometimes usually will pull a blood glucose, like a this is your number right now, but that can really have a lot of variability depending on when you ate, what you ate.
Correct.
And so
that's why fasting is the best, isn't it?
Fasting gives you a good picture of how your body's handling blood sugar, glucose. And so if you're fasting and it's elevated, you know, if you go into the doctor, usually if you're going to have labs done, they'll want you to fast, because that gives you a good picture. If your blood sugar's elevated.
I just had mine Monday.
I hope you had some good numbers.
Yeah, fortunately I did.
And so if that number's elevated when you're fasting, that means your body is not, is not able to pull that glucose out of the bloodstream as well if your blood glucose is elevated. But the A1C gives you a much better picture of what's going on overall from several months in the past. So it's kind of a look back. And so if you're trending up on your A1C, it's time to do something about your lifestyle. because if you're seeing that your numbers going,
And diet can make a lot of difference.
oh
right?
yeah, oh yeah, absolutely. That's the biggest intervention is diet.
Is it?
Would love to see some exercise too, but if you look at the calories that you're putting into your body and compare it to the calories, the amount of exercise that it takes to burn those calories, you really would be shocked.
I bet.
Because the calories add up a lot quicker than the calories you're reducing or eliminating kind of through exercise. And so diet is the where you want to start with. And if you're seeing that A1C trending up, you should do something. And your provider is really, they have a limited amount of time, your primary care provider. They're going to focus what's going on right now. And, they might not be able to focus as much on the trending A1C, but if you're seeing your A1C go from 5 to 5.2 to 5.3, 5.5, you're creeping up to prediabetes, and, then you can quickly go into full-blown, diagnosed type 2 diabetes. And we're mostly talking about type 2 here. Type 1 is an autoimmune disorder. There's no known cure to reverse that. So we're talking about type 2, which is diet and lifestyle.
Sandra and I just had a friend that had an amputation because of diabetes.
Yeah, elevated blood sugar over long term affects your circulation and puts you at more risk for infection, amputation, especially uncontrolled. But so that's kind of we're talking about the elevated side of diabetes. But another dangerous aspect is the low blood sugar.
Well, give me symptoms. If there's symptoms either way, but I know that, or I understand that low blood pressure has symptoms that sort of.
Yeah. So low blood sugar. If most folks that are not diabetic, you don't experience this unless you're not eating for a long time. But it's similar symptoms. Anybody can have low blood sugar, diabetic or not. It's more common in diabetics, probably because they're on insulin. Their blood sugar can vary so much more based off what they're eating, the amount of insulin they're taking, what medications they're on. But the jitteriness, you're hungry, you're maybe sweating, anxious, shaking, tremors, and if it gets too low, you can pass out. And kind of be unconscious because you have to have glucose for energy and activity. Your brain lives on glucose in moderation. That's the key. And so it can, from a short-term acute standpoint, low blood sugar is more dangerous than high blood sugar at a singular point.
Can you go into a coma?
You can die. Yeah, I mean, if it stays low and it's not corrected immediately, it can be
That's why you pay
deadly.
attention. That's why the monitor.
Yeah, that's why it's good to have somebody monitoring, because if we see trending lows, we're going to say, hey, what's going on? What are you eating? What medications are you taking? And we might say, hey, let's talk to your doctor about adjusting. We might tell them, recommend adjusting that insulin dose, decreasing the dose. We're not prescribing or changing anything on our own, but we like to get their provider involved on that. So trending lows on blood sugar, really dangerous. And so, highs.
And you don't think about it.
You don't think about it because you're like, I want it to be low.
Yeah.
I need it low. My doctor wants me to have it low, but too low is a bad thing. So we're looking for a sweet spot on the blood sugar. And so, if it's too high, like right now, if somebody checks and it's 300, that's not good, but that will not kill you right now. If it's 50 and you're about to pass out, that's really, really dangerous. And so now, that being said, if it is trending at 300 for days and weeks and months and years, that's when you're at a much higher risk of heart attack, stroke, kidney disease.
Amputation.
That's going to be deadly too, but it's a shorter, a longer, time frame to get to that point where you really see a lot of the repercussions. And so low blood sugar, let's talk about how to treat it, because there's some options there. So if you check, we usually consider less than 70, and we're talking about a glucose number. If you have your monitor,
lower than 70.
Lower than 70 is usually considered a little bit too low, especially if you're on insulin. Some people might have it dip there occasionally and they don't feel that bad and they can handle it and it comes back up. But that's what we consider too low, and we recommend getting some sugar, some carbs in you ASAP. So what do you eat? What do you drink? Easiest is, and what most people have in the refrigerator is, a small cup of juice, 4 to 6 ounces.
Is orange juice best, or?
That orange juice is fine. Grape juice, they all have plenty of sugar. You want to have sugar. Normally you're avoiding it, but you need to keep some in the fridge because you're correcting the low. So, a cup of orange juice is good. They also, at the pharmacy, we carry glucose tablets, especially a sugar tablet. Yeah. You can eat that. They have gel. You can squeeze glucose gel. We carry those. But there's also, those are good options if you're conscious. So what do you do if you're unconscious? So there's actually a prescription medication that we have at the pharmacy called glucagon. It's a prescription hypoglycemia, low blood sugar reversal agent. And the cool thing is that we don't have to have a prescription from your doctor to dispense it. There's a standing order protocol in North Carolina where we can dispense that as a pharmacist.
Well, that's good. So it's like an over-the-counter.
Yeah, you can't go in and buy it. You have to come talk to the pharmacist. Okay. Yeah, so it's kind of like we're prescribing it, the pharmacist. And so there's a standing order under the state medical director, essentially, kind of. And we can dispense it for anybody that is at risk of low blood sugar. And so we proactively look to identify folks on insulin, and we'll dispense this to them so that they'll have it.
What a service.
And so that's glucagon, and what that does, I always like to get into the science a little bit, but so when your blood sugar is too low, the glucagon is going to be helpful. It's an injection for a family member or friend to use, almost like an EpiPen. So if you're unconscious and can't drink some juice to elevate your blood sugar, that's when somebody needs to know about that glucagon. It's like an EpiPen, because you're usually not doing.
So if you have diabetes, it would be wise to have some in the medicine cabinet as a precautionary measure.
Yes, absolutely, especially if you're on insulin, because you're a lot more fragile and you can have low blood sugar more frequently. But it's covered by most insurance plans, and so it's an injection. And so glucagon, again, what it does is it triggers your liver to convert glucose into a usable form that's released into your bloodstream.
The body's a smart tool.
Yeah, and the body does that some on its own.
That's so amazing.
You're kind of potentiating what the body already does, and that process is called glycogenesis. And so what that does is you're kind of using your body's process, but giving it a little boost,
right?
And stimulating that process. So it's a natural process. It's not something artificial, really. And so that's really neat, and that will elevate your blood sugar usually. And so, but like I said, when you need it that bad, usually you're not the one injecting it. So you need to tell folks around you about it.
Well, yeah, communication is always good, but a lot of people have diabetes that live alone.
Yeah, and that can be scary.
That's a warning. That's where the
RPM, the remote patient monitoring, would be really beneficial.
Well, the more I think about that, is how wonderful that is.
Yeah, and the blood the blood glucose, the diabetes is more complex than just blood pressure, because of the highs and the lows, the danger. What do you do? What do you eat? What medications are you taking? There's a lot to unpack there. So if you're living alone and you want another set of eyes and ears helping you manage your type 2 diabetes, the RPM remote patient monitoring program is a great idea. You're already testing at home. Just swap out your meter and then we see it.
Tell them how much it costs.
Yeah, it's covered. No cost for most Medicare plans.
You understand that? No cost.
No cost. So a ton of value, no cost. You get a free monitor, free strips, free Lancets, and we continue to oversee that, and you don't have to pay your copays that you were paying on your diabetic supplies before. And so a lot of value. Our patients are loving it that are doing it. We've got a lot of patients enrolled, and so it's been a great program so far.
Well, as we reach to the close, because I got a break, In closing, is there anything that you'd like to say in closing, because your information is always so invaluable?
Yeah, I would say so. Really, if you're worried about low blood sugar, if you experience episodes of low blood sugar, not everybody has them. Some people have them more often. And I would highly encourage you to come down to Medical Park Pharmacy, 901 North Winstead, Suite
Scotland
100,
Neck.
and then also McDowell's Pharmacy in Scotland Neck if you're closer to that side of the world, and ask about getting some glucagon. Tell us that you have low blood sugar and that you heard that we provide something that can help with that. It's called glucagon, and so we can dispense that on the spot. As long as we have it in stock, we usually do. We can dispense it on the spot for you, and so we would love to help you with that. And if you're considering remote patient monitoring, like I said, no cost for most patients. Stop by and see us, call us. We'll get you set up on that.
Well, we're gonna. I don't know if you can bring something to show them.
Yeah.
That
I
may
can bring the glucagon next time.
because I'm gonna stay on this,
Yeah.
or Sandra and I gonna stay on this.
Yeah.
But Thomas, we appreciate your being here today and continually providing the great information. But we're going to take a break and be back. And when we come back after our advertisements, we're going to be talking about the Small Business Awards and the winners and everything at the recent Small Business as of last
Yeah, I was
evening.
there last night. It was
Well,
great,
good.
Great time.
But thanks again.
Thanks, Roger.
Yeah.
Enjoyed it.
Yeah.